and welcome back to The Wrinkle. Today's topic is dementia perks. Are they a thing? I don't know if you've ever read The Fault in Our Stars by John Green. I love his books. And the book, The Fault in Our Stars, is just, it's wonderful. It's funny and it had me in tears, but so poignant and so beautiful. It's not a spoiler if I tell you it's about young people with cancer. And they are really funny. There's a lot of black humor in this book. And they have this thing called cancer perks. So it's kind of like the one kid's mother celebrates their birthday and then celebrates their half birthday. So they have like a big birthday celebration every 6 months. And they call it the cancer perk because it's just one of those little advantages of having cancer. People give you special treatment. And I was kind of having a discussion with someone else who is a care provider for someone who's living with dementia. And they said, it's almost like the dementia gives that person a pass to do some things that, I kind of feel like the person shouldn't have a pass to do. So an example might be somebody taking over something for the person, like maybe something they didn't really like to do, like cooking or going to the bank. Because they just feel like, they have dementia now, they shouldn't be doing that. Or another example is, and this was what the person was talking to me about, was that the relative who has dementia will sometimes say things that are a little bit mean or will be that disinhibited behavior. So things that the person might not have said when they had their filter that was intact. So now saying these things. Hurtful comments that the person might have said in private, now they're saying it in public. Is that a dementia perk that should really be tolerated? Well, you know what? That's a complicated question because a lot of my job is telling people that the person who's living with dementia has a different level of control over behavior because of the dementia. A big piece of advice that we give over and over again is to go into the world of the person who's living with dementia. Don't argue with the person because you will not win. Because the changes that come about because of dementia change the way that a person perceives things. And if that's not aligned with your perception or what you think is the reality of the situation, you might get into an argument. So if your mom can't find her purse and she's looking for it and she accuses you of stealing it, well, the reality is that your mom has lost her purse, but your mom's perception is that you've taken it. Getting into an argument with your mom and telling her you haven't taken it, that's not going to work. So the strategy is a bit different. So it's acknowledging her point of view, distracting, and then kind of trying to find the purse together and trying to just diffuse the situation rather than reorienting in reality. So does that mean that your mom is exerting dementia privilege by being able to accuse you of taking the purse? You can see it's complicated. There could be a reason to, in some cases, not allow the dementia perk to take place. And an example would be taking over a task for the person who's living with dementia when they are perfectly capable of doing that task themselves. We use the term learned helplessness to describe that. For a psychologist, learned helplessness is a little bit different. Learned helplessness is when an animal, for example, a lab animal, is given a task to do over and over again that produces sort of a painful stimulus, but they keep doing it and eventually they just become, they kind of get into a despair situation where they're resigned to doing this thing that's going to be painful. But what I use learned helplessness to mean is that we're teaching people to be helpless. If somebody is capable of doing something, so someone who's living with dementia walks a block to go and get the mail every day. When they receive the diagnosis of dementia, some people might say, I guess you can't get the mail anymore because you've got dementia now. Well, it may be that someday that task isn't going to be a good fit because the person's skills will change. But right now it is. And if we take that away, we're kind of instructing the person with dementia, we're teaching them that they can't do that anymore. And so we're depriving them of that autonomy and that control before we really need to. And that's not a good strategy. A good strategy is to try to have a person who's living with dementia have as much control as possible. And sometimes we realize that we should have taken control over sooner. But as long as that is, we're managing the safety risks as best we can, then I think we should allow people to have control for as long as they can. So we don't want to invoke dementia privilege or dementia restriction before we absolutely need to. So do dementia perks exist? They might. We might be more inclined to cut somebody some slack if they're saying things that are disrespectful or avoiding things that they maybe don't want to do because the excuse is that they have dementia. We shouldn't let people use dementia as an excuse, but we do have to take dementia into account when we're considering somebody's behavior. Let me know what your thoughts are. Hey, it's Dr. Didyk checking in to see if you want more wrinkle. That didn't sound right. How about if you want more of the wrinkle? If you enjoyed this video, give it a thumbs up, and if you didn't like it, give it a thumbs down. There's a space below to leave comment, and you can always hit the little red rectangle to subscribe. There's lots more wrinkle over on Facebook as well at @TheWrinkle2. Thanks so much for joining us here today, and I'll see you again soon on The Wrinkle.